The secondary victims of schizophrenia need support. The children of schizophrenic parents, we're the silent victims of this mental illness and the most vulnerable and in desperate need of support and guidance. How can children of schizophrenic parents be supported so that they're not dealing with the full force of trauma on a daily basis?
That's such a wonderful question. It's so multi-layered, the answer. So ideally, there is at least one high-functioning adult in the child's life when they're growing up. And that person can help take care of the schizophrenic person and shield the child from a lot of the effects of the disease. When that doesn't happen, I don't have statistics, but it often does not happen for a lot of reasons.
Right.
For instance, extended family can be very put off by the schizophrenia,
Yeah.
and afraid of the behaviors that the schizophrenic person is exhibiting. And so they tend to stay away a lot of times rather than move in and help. So
Right.
if, as you can imagine, adults are afraid of those behaviors a lot of times. You can imagine how the children are feeling.
Yeah.
And also the behaviors of the schizophrenic mom will often push away people who try to help.
Yes.
We had a neighbor visit our home one time, asking if she could do something to help because she had seen my mom out in the street, whatever. And my mother literally chased her down the sidewalk, and she never came back. So it's a very complicated situation. So then comes the next layer of people who could help. Schools, they often don't have any clue what's going on, and the schizophrenic mom will often chase them away as well when they do try to intervene. And mental health professionals
Yeah.
often are so overburdened with trying to help the schizophrenic person and many, many others that they don't even have time to think about the children.
Right.
And when they do think about the children, they really don't know what to do.
That's right.
So one of the things I was hoping my book would do would be to educate folks who are in the mental health field to take a look at and inquire about who do you live in the home with? How are they doing? Now, again, we have laws that say the mental health professional can't talk to the family without the schizophrenic person's consent. So that's a barrier because sometimes they say, no, I don't want you talking to my family.
Yes.
But, if there's a good relationship between the mental health professional and schizophrenic person, that can be overcome sometimes. And I would encourage mental health professionals to try
Right.
and refer family members for support through NAMI, through therapy,
Yeah.
and not just treat the schizophrenic person, but everybody in the family who's being affected by this disease.
Exactly, because it's not only the children, the partners as well.
The partners, absolutely.
Yeah, and how they struggle.
Partners are often confused and don't know what to do.